Hello everyone, I'm Dr. James Chen. I'm from Beijing Tongren Hospital from China. Today, my topic is Tongren Hospital special treatment for allergic rhinitis by puncturing on sphenopalatine ganglion. My hospital is mainly treat ENT disease and eye disease, and we are lucky to be one member of WOFAS. Especially in 2017, we have to be one of the inheritance bases for acupuncture moxibustion of TCM, World Federation of Acupuncture Moxibustion Societies, Beijing. It was founded in April 2017. And also, we set up Beijing Municipal Administration of Traditional Chinese Medicine, licensing Beijing Tongren Hospital with the Xinwu famous and old medical studio. In last 20 years, we joined to write some famous books about eye disease and ENT disease, and some English books for the medical doctors in Capital University. Today we want to talk about allergic rhinitis. About this disease, it was very famous because it's a global health problem. Allergic rhinitis morbidity around from 10% to 40%. In China, we have proved that in 2005, allergic morbidity is around 11%, but only after 6 years, until 2011, its morbidity have reached to 17.6%. This is some the paper write about it. In ancient China, there one of the medical therapy, we call it immunotherapy, is more important than the four inventions of ancient China. As we know, the disease variola vera is killed many people, but some ancient Chinese doctors find a way to help the people prevent this disease. They take some discharge from the patient's nose of the variola vera. Then they dry the discharge and keep it in healthy people's nose, and to have a immune system therapy. So this is maybe the first, very earliest immune therapy of the world. Ancient Chinese people have some new opinion for the nose. The basic opinion is our lung open from the nose, and all of the 12 meridians and some collateral meridians. About the nose, Asian Chinese people think the lung open from the nose and the energy of the meridians, they transport to upward to our head from the nose. So the nose is a very important organ to touch with the nature and the body. So the rhinitis is very important to treat with not only Western treatment and also acupuncture treatment. Even in 2015, American Otolaryngological Surgeon Association write the clinic practice guideline, allergic rhinitis. In this paper, the first time to recommend acupuncture to be a useful way to treat this disease. In modern acupuncture, we often use some basic point such as GB20, large 12, and do 23 in tongue, a large 11, stomach 36, and other kind of the similar point to treat allergic rhinitis. But this kind of treatment, generally the frequency is 3 times per week. Even some doctors treat the once per day, and at least over 10 times treatment, the patient can got a good result. So we had write some paper around Chinese Society of Allergy guidelines for diagnosis and treatment of allergic rhinitis. In this paper, I especially to recommend one special treatment. This acupuncture technique, the skill we named as the Xinwu, acupuncturing on feather pelleting ganglion. We can see this picture. We use only one needle, treat on one point. We treat on the face and can stimulate the patient's ganglion and to treat the rhinitis. We got a good result. Compared with Western medical treatments, such as drugs, operation, and desensitization, we find some shortness of the Western medical treatments. Firstly, it's not stable. The disease is reoccurred, and secondly, Western operation a little bit painful and expensive. Thirdly, if we use common Western treatment, it's very expensive and need long time and only for dust mite is useful. So for most of the allergic rhinitis patient, we have not enough useful way until today. In this kind of background, in 1968, Professor Li Xinwu he created a special way use acupuncture stimulate the person's feather pelleting ganglion to treat the allergic rhinitis. We can see this manipulation is a little bit hard to get exactly to the ganglion because the ganglion is hidden in a very narrow crack of the head. This Professor Li Xinwu is my master. This is a picture I followed my shifu to learn this special skill. This is some of the paper of the Professor Li Xinwu. some doctors are confused with this way. How the acupuncture can treat the patient allergic rhinitis? I give you a symbol. For example, the person have many meridians in the body, the qi and the blood, such as some the cars running on the highways. You can regard the cars as the energy of the body. Generally, the cars they under a good control and in a good order, but sometimes when they have a traffic jam, such as the middle picture, and all the cars they are blocked there. This is such as some disease. We have the pain feelings, or such as the rhinitis. We have allergic rhinitis. So we can use the acupuncture to regulate the order of the cars. You can regard the acupuncture, the needle, as a policeman. The policeman can bring the new order, a good order for the energy. And also, you can regard the meridians like the pipes. Sometimes when the valve have problem and the body lose the healthy, so we can regulate the pressure of the tube, such as we use tools to fix it, and then pipes no block and we haven't pain after the regulation. In modern society, I often to see some doctors like use more and more needles, such as this picture. This picture is not, I think, is real, but it's not very often, not very common, because it's waste too much the needles. This is not good doctor because it will use too many needles on the back and even hurt the person's normal healthy. So we have a useful way. One needle can treat the disease. This is amazing thing. I give you an example. Before there's a famous engineer named Stemmons. Once he have fixed the work line for the Ford motor cars. We can see this picture compared. In the clinic room, if you are a patient, do you want to use such many needles on your back, or you prefer use one needle can treat your disease? I believe most of people prefer one needle. Before have a famous story similar like the acupuncture. A German engineer named Stemmons had helped the famous Ford automobile factory to fix their production line. He observed the broken production line for several days. At last, he wrote a white line and asked the workers to open from there and fix. After they fixed the production line, the people asked how much he need. He said $1,000, $10,000, and Many people confused and feel it's too much, but the engineer side, you write the one white line only need $1, but you need to pay for more $9,999 to know where we can use this line. So acupuncture, the value is not very expensive, but if you use that on a proper way to treat the disease, this is a very valuable treatment. So compared with the common puncturing, sphenopalatine ganglion treatment have very good obvious advantage, such as a point. We only use one point enough, but common acupuncture need at least over 6 points. The frequency, sphenopalatine ganglion puncturing once treatment per week, but common acupuncture need over 3 times per week. Sphenopalatine ganglion treatment needn't retaining. The common acupuncture need over 20 minutes at least. And the effect, sphenopalatine ganglion treatment is more lasting, but the common acupuncture is short. So on the 4 aspect, sphenopalatine ganglion puncturing is very useful. This is a picture you can observe before SPG treatment. We short the sphenopalatine ganglion acupuncture. We call it SPG treatment. The patient's allergic rhinitis is blocked, but after treatment only 30 seconds, we can find that is more empty and the breath much good. And after 10 minutes, it still have a good way. This is all even for the long time treatment. Allergic rhinitis patient, the nose only keep a good change. So the basic theory of this treatment, we can regard it like Chinese medicine and Western medicine together. We use acupuncture, these two, to treat the special ganglion. We got a obvious change. So I think this is a creation. In last year, because COVID-19 is very popular, acupuncture actually can supply a new idea to treat COVID-19 after stimulating anti-inflammatory pathway between nerve vagus and choline. SPD treatment, the basic of the theory is because this ganglion covered 3 roots of nerves. The first one is the parasympathetic nerve root. The second is the sympathetic nerve root. The third is it covered sense nerve root. So it can regulate the mucosa of the lacrimal gland, palate, and the turbinate. So controlling senses and the excretion of gland. It also was inflected by the can reacted by the SPG stimulation. So this treatment advantage we can see from this picture. In Tongren Hospital, in Professor Li Xinwu have treated over 200,000 people, and the infection rate of chronic rhinitis is over 90%. Allergic rhinitis is over 70.4%. So this is it proved it's really a good way. So when you can regard our sympathetic nerve and the parasympathetic nerve is the same like the yin and yang of the body. We have to keep it balanced and to avoid the disease. So acupuncture of SPD can help the body back to balance of the nerves. This is our team in Torrey Hospital. In the middle is the leader of our hospital. We researched much theory and many tests to prove the treatment is useful and write some papers. This is one of the paper and in scientific reports, and we can see some the change after acupuncture. So the people's ventilation of the nasal can change better after acupuncture SPG. So at least the acupuncture SPG is not only treat the rhinitis and also can treat facial spasm, paralysis, tinnitus, deafness, and many this kind of the disease, and also some disturbance of blood coagulation. We have to avoid it. And some person either needle faint, even empty stomach, and some serious heart disease patient avoid to use this way because acupuncture on the SPG is a little bit stronger feeling. And the manipulation is we have to find it accurate. With inserting the point is on the zygomatical temporal tubercle. On this special point, we named it the special inserting point, Xinwu point. Xinwu is Professor Li Xinwu. And when we treat it, we have to find a special angle and direction. It's not vertical to the skin. Before acupuncture, we have to use the one hand finger, index finger to find a proper inserting location. And you can regard it like an arrow. But after we insert, we can see the person's disease change a lot and quickly. This is one case of the allergic rhinitis, and also the patient have some chronic rhinitis. We have tried to use acupuncture in front of an American doctor, and he feel our treatment is amazing and can bring more useful change after seconds. You can see the picture in before treatment and after acupuncture. Sphenopalatin ganglion. The person feel much better of the nose. The block reduced much. This is some pictures. We treat the foreigner patient and also treating them. Torrey Hospital is a very long history hospital. we generally use excellence, loyalty, diligence, and harmony. Use the four aspects and to show all the Tongren Hospital doctors. I believe the SPG treatment is amazing, special, and I hope it can renew our acupuncture technique, and hope we can together to develop TCM for the world, for the people. Thank you, everyone. This is my basic introduction of the researchment of SPG Tongren Hospital. This is some touching way by email and Instagram. Thank you for your attention. Thank you.